Hello and welcome to GDHF Day 3. We are coming at you live with the pop-up studio, and we have a number of fantastic interviewees who are going to walk through our pop-up studio booth here. So, all right, we're going to start you first with Carlos here. So do you want to say a little bit of who you are, introduce yourself?
Certainly. Thank you, Nick, and everyone. My name is Carlos Llerena. I'm the head of partnerships and growth for Prekel.org. I've been joining this event for like years already. So
How many years? How many?
since 2018,
Wow.
that was my last one. And so it's great to be back after COVID and all of that, see some familiar faces.
So Carlos, you're at Prekel. I've been asking folks in the booth here, what are some digital health, global health trends that you're tracking closely, that you're excited about as we turn the corner into 2023?
Definitely. So I think in terms of the work that we do, what interests us is the ability of directly communicating with citizens. I believe that, there was a lot of hesitancy before COVID-19 actually, but then everybody wanted to communicate with people remotely during COVID-19.
Sure did.
And so from that perspective, I think it opened the door for people like us doing direct-to-consumer type of communication. What I'm looking forward in 2023 is really what were the learnings from that perspective. We did a lot of chatbots, for example. Some were great, some other were not that.
Some great, some not so great.
Exactly. So how can we learn from that perspective, improve and really support our citizens with relevant health information?
Carlos, for folks that are watching, they may not know about all the amazing work you do with chatbots, particularly on WhatsApp. Do you want to share a bit more about Turn.io and some of the work that Prekel is doing on specifically on WhatsApp?
Sure. So we believe that citizens, we don't like to call patients, citizens, we have the right to receive health regardless where we are. It doesn't matter our socioeconomic status. And so from that perspective, our ethos is how can we support not only citizens, but health workers with the right information at the time that they need it, the way they need it. So a lot of our work goes into what we call transcreation, which is not only translation and localization, but
I love that.
having information that it's specific for the type of people that we're addressing in the way that they want it, when they need it. So that's pretty much the core of what we do through WhatsApp on Turn.io, but also SMS, USSD, whichever medium is the most relevant.
Okay, Carlos, so we've been here 3 days now. Any highlights from conversations you've had or sessions you've attended that you'd like to share with the audience?
Yeah, I think of interest has been the work done in Ethiopia. I think in my previous experience at the Maggie, I did a lot of work with the ministry there, and it's just it kind of brought up the importance of dealing and engaging with ministries of health, with governments in general, to have sustainable type of engagements and systems in the long run. So there was a couple of sessions around Ethiopia that I really enjoyed, and hoping to take that learnings with us.
Well, Carlos, we're so grateful you came all the way to the U.S. to be with us today, and enjoy the rest of the remaining hours of the conference here, okay? All right, sir. Take care.